Knowledge is power. Did you know? That mottled, lace-like pattern on the skin in the image is a condition medically known as erythema ab igni, more commonly called toasted skin syndrome. It is a skin reaction caused by prolonged, repeated exposure to moderate heat, infrared radiation, that is not quite hot enough to cause a direct burn, but intense enough to damage the skin's surface and blood vessels over time. How it happens? When you expose your skin to a heat source consistently, the heat causes changes in the elastic fibers of the skin and dilates the superficial capillaries. This leads to hemosiderin deposition. Essentially, tiny amounts of iron from your blood leak into the tissue, staining the skin in that characteristic reddish-brown, net-like pattern. Common culprits: laptops. Frequently resting a warm laptop directly on your thighs. Heating pads/hot water bottles, overuse for chronic back or abdominal pain. Space heaters, sitting too close to a heater under a desk for hours. Heated car seats, frequent use during long winter commutes. Key characteristics. The syndrome usually progresses in stages. 1. Early phase. The skin appears mildly red and itchy. The pattern may be temporary and fade when the heat is removed. 2. Developed phase. The pattern becomes fixed and turns a darker brown, purple, or slate gray color. The skin may feel slightly thinned or atrophic. 3. Chronic phase. If the heat source isn't removed, the pigmentation can become permanent. Is it dangerous? In most cases, toasted skin syndrome is harmless and asymptomatic, meaning it doesn't hurt. However, there are two main things to watch for. Underlying issues. Sometimes people use heating pads to mask a deeper, undiagnosed pain. Skin changes. In very rare extreme cases of lifelong exposure, like some industrial workers, these lesions can eventually develop into skin cancers, such as squamous cell carcinoma. How to manage it. The most important treatment is immediate prevention. Remove the heat source. This is the only way to stop the progression. If caught early, the marks may fade over several months. Use barriers. If you must use a laptop, place it on a desk or a cooling pad rather than your lap. Consult a professional. If the skin starts to develop sores, ulcers, or hard lumps within the pigmented area, you should see a dermatologist immediately.